Hey guys, welcome back to the podcast. This is Harmony, your podcast host, and today I'm doing a solo episode on bridging the gap between Western and Eastern medicine. And I feel that this is becoming more relevant in the modern healthcare landscape today. And I'm really passionate about this topic because I have been and I am in both of the worlds. I am in the Western medical world. I'm also in the Eastern medical world. So, as you know, my health and wellness journey, I started off as a registered nurse. I still am a registered nurse and have been for almost 20 years now. That sounds crazy to me. But the last, I would say, 12, no, my kids are 12, so a bit longer than 12 years. I have heavily been invested in Eastern medicine, and that's how I've mostly been supporting my lifestyle, my body, my family, my all of my energy and study has gone into learning the art of Ayurveda, and I'm just completed a master's in traditional Chinese medicine as well. So I'm really passionate about bridging the gap between East and West. And I wanted to speak on this topic as well because I think there's a lot of misconceptions about both. And having been in both of those worlds, I'm happy to, bust a few of those myths for you as well. So, let's start by outlining the core principles of both systems. Western medicine, which is familiar to most of us, probably not everyone listening to this podcast, because I dare say you guys are all holistic health advocates. But we know what Western medicine. It's our medical system here in Australia, the US, the UK, most parts of the world, right? It is what you typically see in hospitals and a doctor's office. It's rooted in evidence-based practices with a focus on diagnosing disease, treating symptoms, and often using medications or surgery as interventions. Think of it as a system that's really good at addressing acute, immediate issues, things like infections or broken bones or life-threatening conditions. So if you were to run across the road and get hit by a car, you are so lucky and privileged to have a hospital, hopefully close by, where you can get rushed into, you can get all of the fluids you need, surgery if required, blood if required, whatever is needed for you to survive that trauma. We're so lucky. So I don't think we should always just be ragging on the Western medical system because it does serve a place and a purpose. However, Eastern medicine, whether it's Ayurveda or traditional Chinese medicine or other holistic traditions, it takes a different approach and it's more focused on preventative care and maintaining balance within the mind, body, and spirit. So instead of treating specific symptoms, Eastern medicine really looks at the root cause of imbalances and addresses the whole person. We use herbs, diet, lifestyle adjustments, and energy work like acupuncture or pranayama to support the energy system of the body as well. Now, Eastern medicine isn't just preventative, it's definitely a treating medicine as well. So it can treat some conditions and it's really good at supporting chronic health conditions. So, like women with PCOS, I've seen Eastern medicine be so supportive where the Western medicine medical system hasn't been able to do a lot for those women. Supporting women with endometriosis, supporting people with diabetes, like all of these sort of chronic conditions is really, really good at supporting as well. And in Ayurveda, for example, we look at the doshas. So we look at an individual constitution of a person. And so everything is prescribed to them based on their individual constitution. Whereas in Western medicine, generally what happens is you'll come in and say you've come in like with an abdominal pain or something like that. You come into the emergency department with an abdominal pain. They'll investigate to make sure it's nothing too sinister, and then they'll usually go down a pathway that's pretty rigid for abdominal pain, and they may get the same sort of medication depending on what the end diagnosis is. So whether they've just come in because they're completely constipated and they haven't gone to the toilet in forever, they might shove a few enemas up the butt and hope they poo it all out and that they're comfortable. But it could be something like gallstones or appendicitis where they have to go to surgery. Um, And so it's sort of like this, I guess, a systematic approach, you could say. Whereas with Eastern medicine, we would look at not only the person coming in with abdominal pain and what the symptoms are and what the actual diagnosis is or the cause of that abdominal pain, but we would titrate the treatment, which would include like the herbs, the diet, the lifestyle, and all of those type of things, and the recovery to their individual constitution. So whether they're a Vata, Pitta, or Kapha. If you're experiencing, for instance, like anxiety or insomnia, Ayurveda would see that as like maybe a Vata imbalance, while Western medicine might prescribe a sleeping aid or an anti-anxiety medication. So you can see how they differ, but they definitely can work together. And I think that Eastern medicine is so good at being able to, I want to say, pick up the scraps of Western medicine. I don't know a better terminology, but pick up the pieces maybe after that person has gone, if they've gone into surgery because they've required surgery, for instance, or if they've been put on a medication that they could actually manage with dietary and lifestyle changes, but at that point in time, they didn't have the capacity to do that. And so they went on medication and now they want to wean off the medication with their doctor's advice, of course. Then Eastern medicine can be really good at helping and facilitating that healing phase. So the other thing I wanted to discuss is why integration is so important. Why it's so important to bridge these two systems. Well, it's because no single system has all of the answers. Like I said, if you're in a traumatic accident, you want to be able to have access to sterile emergency care, which is our Western medical system, right? It really excels in that acute care and also the advanced diagnostics. So even in my practice as an Ayurvedic women's health practitioner, I will often ask my clients to get pathology, so get blood tests so I can have a look at them more so from a functional medicine point of view, from my holistic understanding. But, I'll still get them to get the blood test. So that could be a more of an advanced diagnostic tool to use, maybe ultrasound, especially if they've got a lot of like lower abdominal pain, because it doesn't always necessarily mean it's to do with their digestive system. Maybe it's the ovaries. So we can lean on these things to have these diagnostic tests, which actually makes our job as holistic health practitioners even better, because we're not guessing, we're testing, and then we can really go down that path and we can get our clients faster results. But where it does often fall short is when it comes to treating these chronic conditions or maintaining long-term well-being. And so I would personally love to see it be a collaboration approach. So if anyone goes to see a Western medical professional, there is a chance for them to get referred on to an Eastern medical practitioner so that we can help keep them out of the healthcare system by providing them with like a really holistic healing aspect to whatever they've gone through, or preventing them from their disease getting further and maybe even mitigating it altogether. So I think that's where it could really work well if there's a referral pathway between the two. And for that to happen, it will take mutual respect. And this is what upsets me a lot, is because I feel like there's always a fight between these two systems. But why fight when we can collaborate and we can do the best for our people? And I know that the philosophies and the principles of each of these systems are very different. And sometimes that's why people butt heads. But also, I feel like the Western medical system, often they feel that there's no evidence-based practice in holistic healthcare, but that's completely untrue. So there's been a lot of different papers and articles and research put into holistic health methods. However, it is a lot more difficult to get those results because a lot of the things that Eastern medicine does, like lifestyle and diet, you can't really have a placebo for that. Whereas in the Western medical system, you could take a placebo drug, meaning that it's not a drug at all, and you can take the real drug, and the patient wouldn't, if they're in the study and they've consented to being in the study, they wouldn't know the difference. So you can really analyze the data really well, but you can't really give a placebo diet or a placebo lifestyle. So it really is based on case studies and peer reviews and things like that. There has been a lot of placebo acupuncture studies that prove that acupuncture, genuine acupuncture, where they've got the right acupoints, is more effective than placebo. But again, it's a lot harder to create evidence-based studies on holistic practices. Herbs, they can definitely do it with herbal medicine, and there has been a lot with herbal medicine, and there has been so many promising results. And we have to remember that most of our pharmaceutical medicines today have actually come from the knowledge of herbs and herbal medicine, or even are still made from herbs, or are a synthetic copy of that herb, because herbal medicine is our traditional medicine, and it is so impactful, and can be so healing, and it's really, really powerful. So there has been a lot of studies on herbal medicine which have proven its efficacy. And so that is definitely one aspect of holistic health that can be very much so evidence-based. The other thing is that the money, it takes so much money and a lot of grants and a lot of people to research a topic properly. In the Western medical system, there are huge companies that will pay for the research and back it. Whereas in the Eastern medical system, there are not a lot of people that, can pay out of pocket for the research, or there are not a lot of companies that will back it, like pharmaceutical companies, etc., because why would they back it? They wouldn't push their medications and stuff like that. So there is a discrepancy between the evidence-based medicine, based on the fact that there are so many more roadblocks and challenges for the holistic health world to be able to get that evidence-based like research going. So that is one important point that I wanted to make. But by integrating the two, we can definitely create a more comprehensive approach to healthcare. So, for example, if someone has hypertension, which is high blood pressure, Western medicine might prescribe medication to lower the blood pressure, but Ayurveda or TCM would like address maybe the stress of the client. Are they like so stressed? Is that why their blood pressure is high? Or is it their cholesterol? Like, do they have like, their veins are clogged up, and so they've got that higher blood pressure? What is actually going on? So therefore, would it be we are addressing the stress, we're addressing the diet and the lifestyle factors contributing to the high blood pressure, to create a long-term plan that is sustainable? So the combination of both systems address both the system and the root cause. So it's not to say that that patient shouldn't be on blood pressure medication, because actually maybe they should, maybe they need to, whilst they're sorting out their diet and their lifestyle and their stress, because sometimes that takes a little while, and we need a bit of a buffer, a bit of a time where we can actually let the body recover by having these interventions. But then perhaps if that client changed and they supported their diet and lifestyle and their external stress, maybe they wouldn't have the high blood pressure, right? But again, it's about a collaborative approach. And with my clients, I'm always in collaborations with their GP, definitely not against their GP, because they also have gone to uni and studied for 5+ years to learn their medicine. I have gone to university to learn my medicine. They're different medicines. It doesn't mean that anyone's right or wrong. I might prefer my medicine, but it doesn't mean it's 100% right. And I think we need to understand that we can work together for the best outcome of the clients. Now, the other thing is when we look at chronic conditions and complementary care. So chronic conditions like diabetes, autoimmune disease, or digestive issues are a perfect example of how these systems, again, they can work together. So Western medicine gives us the tools and diagnosis to manage these conditions, but often the lifestyle changes needed to truly heal are not a part of the approach that the Western medicine system provide. Like they might guide their clients, they may say, hey, you got diabetes, eat less sugar, eat low GI, and maybe refer them onto a dietitian, but there's not really that full on support. And so this is where Ayurveda and or traditional Chinese medicine can come in, because these systems emphasize the important for daily, not like daily routines, diet, mindfulness practice to create that lasting change. So I think it's always important to have a holistic health practitioner in your corner if you want to create holistic health changes. Another example is in Ayurveda, we look at the strength of the Agni, the digestive system. So if your digestion is weak, toxins known as armor in Ayurveda, they build up in the body, which can lead to chronic conditions like joint pain or skin issues. So by strengthening your Agni through specific dietary changes, herbal remedies, and dinacharya, which is a routine adjustments, you can not only manage the symptoms, but also improve your overall health and possibly even the condition. Whereas often, if you have some sort of skin issue, you might go to a GP, then be referred to a dermatologist and have some topical cream. They don't generally talk to you about your Agni and your gut health that could be causing the skin issue in the first place. So again, I think it's really important to be open-minded and always look for what's best for you. One of the most significant areas where Eastern medicine has always excelled in understanding the mind-body connection. And I know Ayurveda specifically have long, like really recognized that emotional health and physical health are deeply intertwined. But I'm happy to say that in recent years, we've seen Western medicine start to adopt this perspective as well. So this is a point in time where we're starting to see that gap being bridged, which I absolutely love. Western medicine, there's now been a lot of acknowledgement that stress, anxiety, and depression have a profound impact on our physical health. And there has been emerging studies into this. There have been studies where they've like looked at the brain wave under MRI and stuff like that for people who are meditating and all of these wonderful things. So I'm really excited with this move forward from Western medicine implementing that Eastern medicine approach. And you will often, well, I shouldn't say often, but I know that there are a lot of GPs that I've communicated with that also practice meditation and yoga and mindfulness and have shared that with their clients as well. These are all Eastern medical traditions. And so they're very much being integrated now in the Western medical recommendations, especially for conditions like anxiety, insomnia, and even heart disease, which is absolutely amazing. I'm really excited about that. And another like really strong point that I love about Ayurveda and Eastern medicine is that it emphasizes on personalized medical care. For example, Ayurveda tailors treatment plans based on your unique dosha constitution, as I mentioned at the start. And TCM considers the balance of yin and yang as well as the flow of qi. And so that's how they start to prescribe their different herbal prescriptions, their lifestyle adjustments, the dietary, even the diet changes. So not all digestive issues get the same diet. They're not all going on maybe a low FODMAP or whatnot. It's dependent on your individual constitution. And this always gets clients faster results and long lasting results, and it gets them to understand their self better, their body better. So in the future, they can protect their own body without having to seek all of this guidance. Because what Ayurveda does is it really cultivates a deeper understanding about ourselves and how our unique body functions. And when we know that, we can implement the changes we need to implement to create optimal health for us as an individual, as opposed to what some protocol says about a certain condition. That may be helpful for some people, but we can't put everybody in a box. I mean, have a look around you, wherever you are now. I'm sure you can see all different people. And if you can't see anyone, think of all the people, even in your family. Like everyone is so different. So how do we expect one way to work for everybody. But interestingly, Western medicine is also moving towards a more personalized care as well, with some sort of advancements in genomics. So looking at like genetics and stuff like that, which is really awesome. But I still think that they've got a long, long, long way to go. Whereas Ayurveda and TCM have been practicing like this for thousands and thousands of years. Don't forget, Ayurveda really draws in the wisdom from the Vedas, which were 5,000 is a 5,000-year-old medicine, and it's still applicable today. We're still using it and healing from it today. So it has absolutely, it might not have all of the evidence-based studies because of the reasons that I mentioned. It definitely has evidence-based studies, but not to the amount Western medicine does because of the financial aspect and the placebo aspect. But look at how many thousands of years it's been used to heal, and it's still healing today. So I think that in itself is evidence that it works. It's been proven over time, well before you and I had been walking on this earth. So lastly, I wanted to come to the point of, well, why is there still challenges in integrating these two methods? And I think, well, I will say that people like to jump on a side and then they don't bother to learn or understand or know about the other side, and they just go all in on their own beliefs, and it can create this sort of riffraff between the two. Whereas if you can have an educational and mature conversation with people who are in both of those realms, you can start to understand that they both have their place and are of great benefits. I think the Western medical world is slowly waking up to the Eastern medicine and the natural health world, slowly, but they still are. However, there's still a lot of doubt about the efficacy. And I think that because it's not as well regulated, they probably have seen a lot of clients come or patients come into their doctor's office that have gone down this path and have maybe been misunderstood, because it isn't a regulated industry, as well regulated, I should say. There are some avenues that are definitely regulated, but the medical world is very much regulated with the amount of CPD points you have to do every year, which is continuing education, with insurances, with like registration, like it's quite a big registration process. You have to have been like degree qualified, all of those type of things. So I feel like there is a bit of a misunderstanding between the two. And I think that people really like to prove their point. Like they want to go, they have their belief and they want to prove their point. And so even for myself, I know I was asked to go on a podcast a little while ago about Ayurveda for women's health. And then the podcast host was a natural health advocate, wasn't qualified in any natural health and wasn't qualified in any Western medicine either. And they proceeded to tell me that anyone who's had, mind you, it was a man who doesn't have children as well, but anyone who had their child by C-section was basically a conspiracy, because there's absolutely no need to have cesarean sections. It's all a big ploy from the medical system to make more money. And I was like, actually, no, that's not really true, because sometimes there is emergency cesarean sections. The cord can get wrapped around the baby's neck, and there are medical people at home, such as the midwives on call, the obstetrician on call, and the anaesthetist on call, that would rather sleep through the night with their family and get up feeling nice and fresh than having to rush into hospital at 2 a.m. in the morning to sort out this emergency procedure and do a cesarean, and then maybe the baby makes it. I know this is morbid, but this is the reality, because I've worked in these departments, as has my husband, and maybe it doesn't make it. And then they wear that, and that can be so traumatic for them. That is not a conspiracy. That is the reality of what can happen sometimes. yes, in private, there are some obstetricians that will maybe push for a cesarean to suit their schedule. But we have to know we're still the advocate for our own health, and we can put a no to that. But it's not a conspiracy that every cesarean section is because they want to make more money, because that's not the case in public health anyway, because they don't make their money per cesarean. So I think there's just like so many misconceptions like that. Then they get spread and then they get put on podcasts, and just like this one, no, but they get, people who are misinformed, spread misinformation, and then people who are so, what do you say, like so hell bent on their opinion, they attract other people like that. And it kind of goes through this rabbit hole without really seeing the whole situation. Then there is also on the other side of that story, yeah, we could definitely be advocating for more sort of natural pregnancies and natural births and stuff like that, if that's what the person wants, and if that's what's going to be best for the mother and the child. So, I think there's a few reasons why these integrations haven't completely taken place. So yeah, like I said, one of the biggest barriers is skepticism, especially from those in the medical community who may not be familiar with the Eastern practices. Because the Eastern practices had, like I said, stood the test of time, and there is definitely ways that Eastern medicine can help heal completely and can help nurture that client back to optimal health. But there's also a lack of standardized training in integrative medicine, which can make it difficult to find practitioners who are truly skilled in blending the true approaches. However, I think there's more room for research in complementary therapies and growing patient demand for holistic health solutions. So we are on the right track, guys. So I just want to wrap it up here. I want to encourage you to consider a really balanced approach to your health. And if you're someone who completely relies on the Western medical world, then look at health not just in fixing your symptoms. Look at health as a really holistic aspect. So from an Ayurvedic point of view, we look at the mental, the emotional, the spiritual, the physical, and the dharmic health of an individual, like how connected you are and connected to your purpose, because that will all leave a subtle impression on your physical body and your mind. And we know that disease can manifest when there's an imbalance in any of those states. So there is Eastern medicine has a lot to offer in both preventative and healing medicine. And if you are someone who loves holistic health and you're all about it, but you have to go down the medical route for reasons that, no one even needs to know about. It's your personal journeys, but for other reasons, don't be ashamed. It's also there to support and help some people as well. So I think there can be a lot of shame in having to go down the medical route, but there should be no shame in it if it is supporting and helping you. If it's not, if it's not just a band-aid, like a band-aid approach. I mean, even if it is, sometimes we need that band-aid until the wound heals, right? And then we can rip it off and sort of heal the skin around it, whatever. But you know what I'm saying, guys? There's no shame. You do what's best for you. And if you don't know what's best for you, then research it and find out, but talk to someone reputable and someone who understands the systems. So I think that is all for me. And again, if you have any questions, please reach out to me on Instagram at Harmony Inspired Ayurveda. If you like this episode, please share it with someone who you think would enjoy it, because sharing is absolutely caring. And my mission is to bridge the gap between Eastern and Western medicine. And I would love your help in doing that. Thank you so much for being here, guys. And if you want to support people with their health, from a natural holistic medical point of view, then drop me a line, because we do offer accredited certifications in Ayurvedic holistic health care.